Hey guys, Dr. Justin Marcagiani here. Today we're going to be talking about root canals. Again, I did a video a few years back, gotten lots of recommendations to do a follow-up on my root canal or what I did, and I'll kind of walk you through my thinking and kind of lay out some options for y'all to think about. This is kind of a hot topic in natural medicine, and so I'll lay out kind of my thoughts on the topic. All right, before we do, please smash the like button, thumbs up, really appreciate it. Put your comments down below. We'll definitely be responding. All right, so first off, I got kind of my outline here for today. I'll pull it up on screen in just a minute. Should you get a root canal? I'm going to give you my general experience about root canals and what I think about it. We'll talk about some preventative things here out of the gate: oil pulling, clove, and saltwater rinses, and hydrogen peroxide. We'll talk about root canal pros and cons, and we'll talk about safer options as well. We'll kind of hit all those options for you guys here today. All right, so first things first, let's look at the anatomy. I think the anatomy is really important. Let's kind of dive into that. What is a root canal? What are we even dealing with? Let me get rid of myself here. Okay, so here you can see this is your tooth on top, right? This is the enamel. This is the hard surface. If you go one layer in, this is where you're going to see the dent in. So you're starting to go one layer in. The conventional thinking is if an animal starts to wear down, that you should just get a cavity. A lot of people on the functional medicine side, people that I've interviewed, as long as you don't get halfway through the dentin, you could potentially recover your tooth via oil pulling strategies, healthy toothpaste that have silver, and remineralization salts, different salts, bone broth, vitamin K, vitamin D. These are going to be good natural CoQ10. These are good natural anti-inflammatory means. Big fan of an Oral-B or some kind of a Philips, toothbrush that's going to be electric. Those things are going to clean like crazy. And then if you use some xylitol and a really good toothpaste with the silver and the CoQ10 and some beneficial bacteria, whether it's Lactobacillus salivarius or Paracasei, or silver or CoQ10, clove oil. They make some toothpastes that do really well. I'll put some of my favorite toothpaste in the description link down below. There's a couple that are really good out there that have some of the probiotics, the prebiotics, some of the nutrients, some of the remineralization salts, some of the CoQ10, some of the silver, some of the beneficial bacteria. So there's a couple good brands out there. So a good toothpaste, good toothbrush will do you quite a bit of ways on the prevention side. Now, on the diet side, of course, the diet's going to be the key thing that prevents a lot of this, right? Your bones are half protein, so good diet, good digestion, good protein, bone broth, vitamin K, vitamin D. These are going to be things. Vitamin K helps you remineralize your bones. Definitely helps with your teeth as well, right? So you have your enamel, you have your dentin, right? Once you go halfway into the dentin, maybe you need a cavity, right? That makes sense. You can always watch and wait and play it very safe. Conventional medicine usually, or conventional dentistry usually, once you start getting into the enamel, maybe halfway or so, they're going to want to start filling. So that's kind of the general thinking. Conventional dentistry does not really acknowledge the body can heal itself as much as maybe a natural dentist or a functional medicine dentist would kind of look at it. And then, of course, you have the pulp on the inside here, and then these are all the nerves and the blood vessels. This is the root right here. And so essentially when you get a root canal, they're essentially cutting off the top part of the tooth here. You're going to obviously get a crown, and they're going to drill down in here. They're going to pull away all the blood vessels, all the nerves, on these tiny little microtubules in here. And the goal is that you're trying to clean these tubules up and then cap it with some kind of a cement or stabilization solid compound on the inside that gives the tooth good stability, because you're leaving essentially a dead tooth, right? You're leaving the outer shell of it. I mean, you're going to be cementing everything in here, and the goal is you don't want to cement in a whole bunch of bacteria and anaerobic bacteria or microbes or whatever, and that can create an infection. Now you do not have an immune system there. All those blood vessels are gone, the nerves are gone, so you don't have the ability to fight and clean this stuff out. And so in conventional medicine, they use typical files, I should say more conventional dentistry. They use files and such. And there's some more cutting edge technology on the functional dentistry side I'll talk about here at the end that could be a good option if you decide to go the way of a root canal. But just kind of giving you a couple ideas to think about. So first off, I had a root canal done 2020, the end of 2020. I had a cracked tooth. Now, the history is that tooth actually cracked my freshman year in college. I remember sitting there and chewing on a cough drop. I had the cough drop sideways in my mouth, and I was just biting it sideways, and it literally split my tooth right in half. I remember just, boop, I could feel it. It broke right in my hand. Came out, and I'm like, okay, that's crazy. So I went back to my dentist. He cemented it back up. So I didn't get a crown until maybe 2015, 2016, and then I was chewing on a nut-based chip, and then I could feel a little crack. and then I got some pain, and the pain continued to escalate. There's nothing worse on this planet than tooth pain, because that pain is so close to your brain. You can't think, you can't talk, loud noises, etc. Now, first off, my diet wasn't great 20 plus years ago, right? I got healthy doing all the things that I do. I think if my diet was healthy, if you were on top of things with diet, lifestyle, bone broth, vitamin D, vitamin K, this wouldn't even have been a thing for me. But there's a lot of people that are coming into the health space that have already maybe have some damage, have some oral hygiene issues, or paid the price for decades of previous poor diet. So we're all kind of in different places in their journey. The question is, what do you do now, right? So for me, what I did was I went and I found a really good dentist that had different options technologically to clean out that cavity. And there was a gentle wave technology that was a really interesting technology that was essentially a pressurized cap that went into that root, and it put a sodium hypochlorite solution, which is essentially a bleach, but it pressurizes it. So it pulsates it through those microtubules, because you have all these different tubules. The goal is that it shakes it and pulsates it through the microtubules and sucks it out. And I'll show you a couple of studies. There's some studies on it where it does get a lot more debris out. One of the big contraindications, if there's any cracks in the tooth, that pressurization obviously goes out the window, because the crack destabilizes that pressure. And so, having spoken with a couple of dentists on the topic, they said, well, you need to be a special candidate for the gentle wave. There's that technology. And then there was a erg or YAG laser technology that had different frequencies. We'll talk about them, that could go deeper into the pulp, back into the dentin, and really disinfect that area. So that was a really appetizing technology for me. I'm like, that makes sense. Because for me, I understood why root canals weren't good, right? You have the potential of basically sealing up a bunch of nasty microbes that you don't have immune system connection to. Now, when you go and you review the other option outside of a root canal, you kind of have your root canal, you have your safe root canal options. Now you can go and get your tooth pulled. But now what are you going to do now? And so I reviewed that option as well. I'm like, well, I can always go and do the Clifford sensitivity test, figure out what materials I'm going to do best with regarding an implant, regarding a screw. A lot of times the zirconium or some kind of a porcelain hybrid tends to do the best. No problem. But then I had to find out that there would need to be a couple of different bone grafts to actually have enough to screw into. Once you go to the back molars, there needs to be enough bone to actually screw into that implant stay. So every option has its pros and cons, and so you have to weigh that out. So I looked at the bone graft option, not bone broth. Bone broth would help prevent that, though. But your bone graft option, so you can screw. Then you got to say, okay, well, what's the chance of infections of a implant coming in there, and then you are still putting a foreign compound into the jaw. And so I weighed it out. And so essentially I said, you know what? I understand why people are hesitant about root canals. So what can I do? What kind of technology can we look at? And so let me kind of go over things here in a minute here and make a little more sense of it all to you. I'll show some of the research on this. So here's one of the YAG lasers that I chose for my root canal. Let's go over that. So this is one of the erbium YAG lasers, and you can see there's some studies on it. They found a 99.16 reduction in bacterial numbers, like you'll see Enterococcus and E. coli. You'll see, 99.2 reduction. Again, you're going to see things pro and con, right? I'm a big fan of laser. I think it makes sense. The technology is non-invasive. You can get in there, right? You can even go 1 to 2 millimeters from the apex, and it penetrates, I think, 1 millimeter into the dentin. So if we go back to this picture right here, if you're putting a laser in, that laser is going into the dentin here. So you can go 1 millimeter back into the dentin, and that's cool because you have this smear layer. The smear layer is where the pulp hits the dentin. Some bacteria can actually hide in there. And so when you look at some of the laser options, you can actually, I'll pull it up here if I can show it in a second. So you can see here with the smear layer, it's pretty cool. There's 2 different frequencies when you're using the erbium laser, right? The ERG-YAG laser. You have the 2940 frequency that actually cleans out the canal. But then you have this 1340 nanometer frequency, which actually addresses the smear layer. That's that pulp going into the dentin. So that's pretty cool. When you look at it like that, I'm like, all right, so we're really trying to address everything holistically here and really get to the bottom of things. And so that made a lot of sense to me. Now, when you looked here, it talked about a 1 millimeter depth. Maybe in the other article over here. This article is looking at gentle wave here. This is very interesting because they talked about gentle wave showed significantly greater cleaning capacity and reduction in residual debris. This is pretty cool, right? They had group 1, group 2, group 3. Group 3 was the gentle wave. Group 2 was conventional rotary. Group 1, no treatment. So they looked at the amount of debris that came out from each group, right? And you could see the amount of debris that came out in Group 3 was the highest versus Group 2 at 67.8. So that was kind of cool, right? Because that means you're flushing more junk out. That means the chance of you leaving more junk into this microtubule area here, this root area, and sealing it up with cement is much lower. So that's cool, right? So it's good to have technology and to be able to look at it. And this was they did this in cows. Look at the study here. Conventional. Yeah, I think it was a bovine. Yeah, canal mandibular molars. Yep, exactly. So this is pretty cool. Good technology there. And this is what it's doing here. This is the gentle wave where they put this little, device here in the pulsatile fashion, pressurizes it, gets into all the microtubules, and then you can suck it all out. So, ultrasonic kind of cleaning. It makes sense. It's good that we have technology like this. Oh yeah, and this is the erbium laser. This is looking at the gentle wave on root canals. Yeah. So reduce more bacterial DNA biofilms. And again, this is using sodium hypochlorite. So if you Google sodium hypochlorite, it's basically bleach, right? And they saw a 97.3 success rate. That's pretty cool. Like that. Okay, and this is just looking at cold laser. And cold laser is another option you can do. What if you have an infection? What if you're trying to address that tooth issue and trying to prevent a root canal? One other thing you can do is try to get a cold laser. 650 nanometer diode is shown to significantly reduce pain, reduce inflammation, didn't need as much of the anti-inflammatory medications. That's pretty cool. And this can be done pre or post-op. So even if you decide to go with a procedure, you can still use it on the backside of it. So that's pretty cool. I like that. And then right here, I did see here penetrated 1 millimeter in deep, which was really nice. I wanted to see that here and show it to you guys. If you guys see it, let me know down in the comments. So we talked about the smear layer going 1 millimeter in. And again, it's also going to deal with the biofilms too, which is really nice. And then right here, the advantage of the YAG laser is going 1 millimeter into the dentin. That is pretty cool because that means you get to go right here. You get to go right into this air and peel off that smear layer. So that's cool. It's good to have options like that. I like that. So kind of looking at things here, just to summarize, we'll talk about prevention and we'll talk about treatment. Let's go hit those things up here. So out of the gates, right? Oil pulling, excellent option out of the gates. Clove oil, you can add a little bit of clove to your oil pulling. What can you do? Just go take a tablespoon of coconut oil or a tablespoon of MCT oil, add a drop or two of clove to it, swish that thing around. That can really get in there. That can be significant. You can also do a sea salt rinse. Get the Neomed sea salt packets, do some RO water, add a packet or two to it. You can even add a drop or two of iodine or a milliliter of silver in there, and you can just gargle with that for 5 or 10, let's just try 30 seconds to a minute. Hydrogen peroxide is also helpful, and then that way sting a little bit. Like with me, when I did it with mine, when I had a cracked tooth, it really stung. But afterwards, it did feel better. You can always dilute it. Like a hydrogen peroxide, 3%. You can dilute it down a little bit, and you'll probably feel a lot better on that front. Now, we talked about the root canal options, right? Let's go over pros and cons. So you have your conventional root canal where they're going to use files to go in there. Again, the issue is the tubules. Are you going to be able to clean all the junk out of the tubules? Are you going to be able to flush it out? That is the deeper question. Can you do that? I've known patients that have had significant inflammation due to stuff being left behind. Now, if you're on the fence and you're like, well, do I need to pull my root canal? Well, go get a 360 cone beam x-ray so they can look and see if they see any inflammation. Obviously, you can just feel and have a doctor do a good exam on you, palpating and touching that area and see what you sense, but also do a cone beam x-ray, see what is left behind, see if you see any inflammation visually on that x-ray. Because you don't want to have to open up that root canal unless you absolutely have to. Now, on that front too, let me show you that. If you're concerned and thinking, well, do I have an issue, right? Well, you can go look at like a tooth meridian chart. This is kind of common in functional medicine or in even conventional medicine. So you can see where the teeth correlate to different organs. Here's a good one here. So you can see 1, 2, 32, 31, 17, 8. These are going to be your common root canal teeth back in the molar area. And so you can see where and what organs they connect to. So you can see your lung. You can see a lot of the colon, right? 30, 31. This is going to be back here on the molar. You're going to see a lot of molars tend to connect into a lot of the digestive system as well. 4 and 5. And so gallbladder, 6, 11. Again, they may or may not correlate. And again, you have a lot of people that may have other things going on that don't even connect to this. But it's good to look at it if you've done a lot of things on the functional medicine front and you're like, I still don't know. And then I have some symptoms that are strongly connecting to this area. And maybe you had a root canal and you want to go get it assessed and looked at, get a cone beam. You can at least go look at this chart and try to make some correlations. I think it's a good option out of the gate. So in general, right, we have our preventative kind of means. Our preventative means are going to be good diet, good inflammation reduction. You can do some oil pulling. You can do 10 minutes a day, MCT coconut, drop or two of clove. You can do some sea salt flushing, right? That's going to be key. Add a little iodine or silver in there. You could add a little bit of hydrogen peroxide, do a little gargle. That's going to be helpful. Get a good healthy toothpaste, a good toothbrush like a Oral-B or a Philips. You know, these things are going to be a lot better in regards to cleaning. I like the Oral-B 360 with the floss action heads. I feel like it gets between the teeth better, gets the junk out. Again, just getting this stuff out is going to be helpful. So you can use a good topical, a good flush. You can use a water pick or even just a good dental. I use a dental tape by Desert Essence that has tea tree oil on it. So when I get in there, the tea tree kind of has a natural disinfectant effect. So I love that as well. And outside of that, if you have a root canal, right, what do? You're conventional with the file. That's option 1. Option 2 is you choose a more cutting-edge technique like a gentle wave or a erbium or YAG laser that are going to have different frequencies that can peel off that smear layer, disinfect into the dentin, go into the microtubules. That's a good option. Really clean things out, vaporize that junk. I showed you some of the bacteria reduction. Again, I'll show it one more time. Again, you know, I've looked at the research. Some are going to say good, some are going to say bad, right? That's what you're going to see across the board. These lasers are very expensive. When you look at them, right, 99.16% reduction in bacterial numbers, Enterococcus and E. coli. That's pretty cool. Some they'll say that they didn't notice much of a difference between conventional, file type of modality that you see with your typical root canal. So there is that as well. So keep that in the back of your head, right? Is that going to be something that's helpful or not? Now, again, if I'm going to go do a root canal, I'm going to go and try to use the most cutting edge technology possible just so I don't have that chance of leaving some junk behind. It's not that much more. I'm going to do it. And then you have the gentle wave technology, kind of pressurized micropulsations. I'm going to use the sodium chloride, going to really force that water and that hydration through those microtubules, irrigate it out. And that also does have a significant amount of pulling all that debris out and not leaving any microbes and infection behind. So those are your 2 good modalities. Keep those in the back of your tool basket. And then, of course, you can get your tooth removed. You can get it removed. Just make sure you're using biocompatible material, maybe a zirconia type of screw or zirconius, that kind of tooth. If you're on the fence, there's what's called Clifford sensitivity testing, where they will actually take your blood and they will mix that blood with the different implant material, and they will look at what kind of an immune reaction occurs. This is a good option if you're going to do an implant. Something's going to be in your body permanently. It's not a bad idea to see how your immune system reacts to it already. So again, there's always best practices, right? You can ask a dentist, hey, I've run 100 of these tests. What comes back 90+% of the time are these 1, 2, and 3. And then you can always take those, put them in your mouth, and do a muscle test. So that's what I did. When I did mine for my crown, I just said, okay, what are your top 3? And it's like this porcelain hybrid and this zirconia. And then I put it in my mouth, did a muscle test, and the zirconia tested strong. The other one tested strong too, but zirconia maybe a little bit more. So I went that method. What are your best 3? Put it inside your mouth. Let the sublingual nerves touch it and hit it. That way it closes the circuit with the brain, so you get a good indication if you have a strong muscle with your deltoid, and then you put it in after and it's weak, then something is short-circuiting that nerve pathway. And if it stays strong, then you know it's not something that's causing it to short circuit. So it's a good option for you. So prevention is going to be the name of the game, right? Diet and lifestyle, supplementation, that's going to be the key. Good toothbrush, oil pulling, hydrogen peroxide, sea salt, maybe a little bit of clove oil in your oil pulling. Those are all good options. Excellent toothpaste. I'll put my favorite ones down below that have the probiotics, the CoQ10, some essential oils in there, some minerals to help with the remineralization aspect. And then you have your conventional root canal option, right? With the files, you have your more cutting edge, gentle wave and laser. Gentle wave, you're going to have to make sure there's no cracks in it or you will not be a candidate. You have the YAG laser, that's going to be a good option, address the smear layer and the deeper sanitization, or you can pull it. But if you pull it, make sure you know that you're going to be a candidate to just drill it in, or are they going to have to do a bone graft, because all that needs to be looked at. You should have good informed consent so you know what way you want to go. And again, an ounce of prevention is a pound of cure. And I get it, like you don't want to leave a tooth in there, it's dead, but the whole idea is you're cementing all inside of that anyway. So you have this cement innocuous kind of compound in there. As long as you disinfect the microtubules, you're okay. Either way, you're replacing it for some other kind of sterile type of metal or, polymer compound, or maybe not a polymer compound, but some kind of a porcelain type of compound. So you're still going to have foreign stuff in your mouth, so you got to pick which evil you want to dance with, so to speak, right? So hope that makes sense. Again, ideally be on the front side of it so you can avoid it totally. Put links down below, and if you want to reach out for more functional medicine support, links down below. You can reach out to my staff. We're happy to get you in. We see patients worldwide on the functional medicine side. All right, that's my take on the root canals. Again, pick your poison on there. Go in, informed consent, so you have all your options, and stay ahead of it so you don't need it. All right, guys, take care. Bye now.